All right, so we were talking earlier this hour about words of the year from Merriam-Webster's dictionary and also Oxford English Dictionary. But on those words of the year lists, nothing about tripledemic. Well, maybe that's because it's a word we're going to coin in the coming year. What exactly is a tripledemic after everybody has been, coming back from the pandemic? Joining us to talk about it from Blue Cross and Blue Shield of Illinois, Dr. Derek Robinson joins us here with Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY. Doctor, thanks for taking time with us. What is a tripledemic?
Greg, thank you for having me with you. It's great to be there in Springfield at WMAY. So tripledemic is what we're living through now as we race to the holidays. Everybody's longing to get back together, and COVID is a little better than it was before, but we've also have significant circulations of influenza and RSV. So influenza, RSV, and COVID-19 equals the tripledemic, and that's what we have ahead of us as we contemplate the holidays that are just around the corner.
Now, we, of course, know, because of recent history, COVID, what it is, how it can spread, how we can limit the spread. We also know about flu, I think, stories of people getting the flu before COVID. But what about RSV? Is this a new kind of, not new problem, a health problem, but is it more prevalent now? And why is it more prevalent now?
Greg, that's a great question. So RSV is not a new virus. It's something we typically see every year between November and April, usually a virus that circulates in young children. We haven't seen as much RSV or as much influenza in the last 2 years as we've been through the pandemic because we've done a lot of social distancing, a lot of mask wearing. So as we've seen the mask wearing come down globally, we've seen influenza spike, and now we have multiple what I like to call classes or ages of children that didn't get RSV last year and didn't get it the year before. And now all those kids are kind of getting it at the same time. And so I think that early incidents we're seeing in RSV, as well as influenza rising and COVID-19 still around, is really straining the healthcare system now. So that's why we're hearing a lot of information about the need to ensure that we stay healthy and well and try to prevent the spread of these illnesses. And I will tell you, as an emergency medicine doctor, it's difficult to distinguish between those three viruses when you're seeing a patient who's presenting with symptoms. But I can tell you we have a variety of viruses in a tripledemic that affect every age group, and that's the reason why it should be something of concern for all of us.
We're talking with Derek Robinson with Blue Cross Blue Shield of Illinois about a tripledemic, flu, RSV, and COVID all at once that public health officials and doctors are having to deal with. Just kind of lay out there what some of the symptoms are and I guess the level of symptoms of when either parents need to get their kids to a physician or if there's some just kind of over-the-counter type of things they can do. What are those symptoms and how should those be treated?
Well, what I would say is that the symptoms are pretty common across them. You cough, runny nose, fever, muscle aches. You can see those with each of these conditions. Typically, RSV is going to impact children that are under the age of 2, especially those under 12 months are at greatest risk for complications from it. Influenza, we also see effect in those younger age groups, as well as the elderly, and COVID-19 we know kind of spans all those age groups. And so certainly, if individuals have concerns about, how to treat that, we definitely recommend that they reach out to their pediatrician or their family physician for advice on it. But I think the most important thing we can do is prevention, and that's something that we've learned, throughout the pandemic. So 2 of these 3 viruses, influenza and COVID-19, we have vaccines available. And every year I encourage folks to get their influenza vaccine. I would tell you that most doctors and healthcare providers get their flu vaccines every year. COVID-19, I just want to note that our elderly, let's say our seniors, those that over the age of 65, did a great job in leading us in vaccination rates, especially during the first and second year of the pandemic. But encourage those individuals in your family and your community who are over the age of 65 to get the latest bivalent COVID vaccine. That's the last dose. Those rates are pretty low in this population right now, and unfortunately, the folks who are over the age of 65 are still the ones who are at the greatest risk of dying from COVID-19. And in fact, they're making up a higher percentage of death rates now than they did 2 years ago. So getting that last booster vaccine is really important, and especially for our seniors.
Dr. Derek Robinson with us here with Springfield's Morning News, talking about a tripledemic. When it comes to the vaccine, Doctor, surely you have people who push back saying they're not going to get the vaccine, and I'm not sure if you're going to be able to convince them. What should they do outside of that? Even with the flu, some people don't want to get the flu vaccine. What should they do outside of that to strive for a healthier outcome to get through this tripledemic?
No, that's the right question, Greg. So a couple of things that we can do. One is if you're going to find yourself in a close communal setting, like the holidays, gathering at someone's home, a lot of people around, consider wearing a mask. Crack a window so you've got ventilation in the house. Hand hygiene is very important, so be sure folks are washing their hands. I know kids look so adorable, and we like to give them hugs and kisses. Try to avoid some of that. keep a little distance from some of the runny noses. If you're sick, stay at home and be honest. Folks want to get together, and sometimes they'll push through and show up when they're not feeling well anyway. And I think you need to be willing to ask folks, hey, how are you feeling? Have you gotten your flu vaccination? Have you gotten your COVID vaccination? Do you have any symptoms? Consider rapid testing. We have a lot of rapid testing that's occurring in the home, so that's good. We got access to testing. But also that means that some of the public reported rates that we're going to see are probably undercounting because there's a lot of testing happening at home. So just remember that we're not only concerned about ourselves, but we're concerned about those folks in our family and our community. We want to keep everybody healthy and well, and that requires us having some conversations, not only about kind of symptoms in this tripledemic, but for another conversation, even about other health issues and ensuring that we're doing the things that we need to do to stay well.
Well, doctor, I just had somebody message me just, simply saying pneumonia or bronchitis. So do we have a quad-demic or would it be a septemic or what about these other issues? Are those also the concern for public health officials out there as we see maybe a sustained cough that could be linked to bronchitis or walking pneumonia is something else that I hear people say that they've had to battle. How are those situations playing out?
Yeah, so when you hear folks talk about bronchitis or bronchiolitis or pneumonia, we're talking about an infection or an inflammation in the respiratory system. And that can be a result of any of these viruses or others. So I don't think we have more kind of any of those different quaddemics, septemics, other things to deal with, but those are some of the diagnoses that an individual might have as a result of having a respiratory infection. And so you can have a bronchitis that could be caused by or exacerbated by influenza, for example, or COVID-19, for example.
So those are things, obviously, you want to stay healthy, all right? So, treat your body right, get proper nutrition. If your choice is vaccines, then talk with your doctors about that situation, but definitely be mindful of others around you. And if you're sick, just stay home. And if you have some of these symptoms or your children have some of these symptoms, definitely contact your physician. Dr. Derek Robinson, Blue Cross Blue Shield of Illinois, greatly appreciate you taking the time with us this morning.
Greg, thanks for having me.
It is Springfield's Morning News on 92.7 WMAY, Springfield.